And thank you for joining us. I'm Natalie Hurst.
And I'm Brent Hunsaker. You know, when it comes to helping people with mental illness, Idaho does not fare well. Mental Health America ranks us 42nd in the nation.
Morgan Wagner shares how one police department is hoping to make a difference in that number. She's live here in the studio with our top story.
Between 50 to 75% of the Boise Police Department's calls involve someone with a mental illness. That's why the department's leaders say they created a position to help their officers in these types of situations. Chief Bill Bone says it's the first position of its kind to be created in Idaho. The title, Mental Health Coordinator for the Boise Police Department.
In our primary role to save lives, knowing that it's the #2 cause of death is suicide among ages 15 to 24, this is something that's service that we need to provide. We need to get those people in contact with the services.
The woman hoping to make the change in mental health care is Penelope Hansen. As mental health coordinator, Hansen will be educating officers on how to handle a situation before it reaches a crisis point. Officers will still be handling most of these calls by themselves unless the case becomes too much to handle.
Although there has been several times already, almost every day, where I get a call and I go out and I meet with somebody that has maybe a more complicated issue or more complicated case and try to link that person with services in the community.
The new position is something mental health providers in the community say they're excited about.
I think it's a good step. Officers obviously having to be like mental health professionals on the spot is probably not the most realistic expectation for them, but to have that like assistance with them would be very, very helpful.
The Boise Police Department hopes that this will be a position other departments around the Gem State will look at and incorporate into their programs. Boise Police Chief Bill Bone says right now nearly 20% of people in jail suffer from some kind of mental illness. He says with this new position, he hopes to save taxpayers thousands of dollars by getting folks the help they need instead of just throwing them in jail.